Can biomarkers predict morning stiffness in osteoarthritis patients? Have you ever woken up feeling stiff, especially in your joints? If so, you might be familiar with morning stiffness, a common symptom for those with osteoarthritis. But can biomarkers help predict this stiffness? Let's break it down. Osteoarthritis, often referred to as OA, is a condition where the cartilage in joints wears down over time. This leads to changes in the bones and low-grade inflammation. Morning stiffness is a key symptom that many people with OA experience after waking up. Typically, this stiffness lasts less than 30 minutes. Researchers have been looking into biomarkers, which are measurable indicators of biological processes. In the context of osteoarthritis, some biomarkers are linked to cartilage breakdown and inflammation. For instance, type 2 collagen fragments are one type of biomarker that has been studied. Other biomarkers include inflammatory mediators and proteins found in blood, urine, or synovial fluid. While some blood-based biomarker panels have shown promise in predicting the structural progression of knee osteoarthritis, they do not specifically predict morning stiffness. These biomarkers mainly reflected joint damage or inflammation rather than the specific symptoms experienced by patients. Morning stiffness can be influenced by various factors, including inflammation and joint damage. Some inflammatory biomarkers, like high-sensitivity C-reactive protein and adipokines, have been associated with the severity of osteoarthritis. However, there is no strong evidence linking these biomarkers directly to the duration or intensity of morning stiffness. Currently, no single biomarker or group of biomarkers is used in clinical settings to predict morning stiffness in osteoarthritis patients. Most research focuses on diagnosing the presence of osteoarthritis or monitoring overall disease activity. The overlap in biomarker levels between osteoarthritis patients and healthy individuals also complicates their use for specific symptoms. In practical terms, while advancements in biomarker research may eventually help identify patients at risk for more severe symptoms, clinical assessment remains essential. Morning stiffness is typically evaluated through patient history and physical examination. Biomarkers could provide additional objective measures of joint inflammation or damage, guiding personalized treatment to reduce stiffness and improve function. At this point, biomarkers can help predict the progression of osteoarthritis and joint damage but cannot specifically predict morning stiffness in patients. Ongoing research aims to find biomarkers that better reflected symptom patterns, including stiffness, which could improve diagnosis and management in the future.